All right, good evening, everybody. I'd like to call to order the Wednesday, October 9th program and budget meeting, and I'll start by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Just a note, my iPad is not working, so if you have a question or comment, old school, raise your hand. I've been asking them for 20 minutes. Next up is adoption of the agenda. I'll take a motion to approve the agenda.
So moved.
Motion from Selena, support from Ryan. All in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anybody from the public going once? Going twice? We will close the hearing of the public. Next is item 5A. Request to approve the revised amendment number 1 to the agreement between Michigan Department of Health and Human Services and Macomb County Community Mental Health. Take a motion to approve.
So moved.
Motion from Selena, support from Lori. Adam, did you want to say anything about this? I know we've talked about this a few times. But.
Yeah, I don't have much information on this one to give it this time.
Okay. If anybody has questions, Dave will be back in the country soon. Anybody have any comments, or Kathy?
Thank you. But this is, again, one of those changes that are imposed on us. We really don't have much of a choice to, we could decline it, but then that kind of negates our contract. So,
Correct.
all right, thank you.
All set. All right. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5B, request to approve the updated MCCMH MCO policy 10-060, determination of financial liability. I'll take a motion to approve. Motion from Chris. Support from Selena. Adam's got nothing. Any? Nick, go ahead.
Is there someone here to answer the questions? Pardon me? You don't have anybody here to answer the questions?
Not on this particular topic.
Oh, well, I have 2 questions on it.
I can absolutely take this back and do some research on it.
Okay. I'm hesitant to support moving something to the board if we don't have answers to our questions, but the first question I had dealt with, and you can mark it down, subsection O, which deals with spouse's ability to pay, and I wanted to know how that compares with Michigan spousal impoverishment law that limits it in terms of Medicaid liabilities and how that interacts. And the other question I had begins with the beginning of the process, which is it appears that this applies only to our in-house service providers. Why does it not apply to contracted providers, or do we do the same thing or something similar in our contracts with those providers?
Yeah, as I said, I don't have an answer for that right now, but I will do some research and get you an update.
Can we get that to him before
Yes.
full board? Okay. Thank you. Brian?
I would move to table this until we get the answers to the 2 questions.
We can't really have discussion once it's tabled, but I'm going to ask Adam anyway if this is time sensitive.
I do not believe this is time sensitive.
Okay. All right, well, we have a motion and support to table this item. All in favor of tabling signify by saying aye.
Aye.
All opposed?
Hey,
And I'm a nay also, so
I'm also a nay.
3 nays, 4 nays. Lori, Kathy, Ryan, and myself. So the motion is tabled, or the item is tabled.
and that's fine.
So we can't ask questions about it?
Once it's brought up
Well,
for,
we can't get answers from it, I mean, that's why, table it until we can get the proper answers to it.
Could we discuss this at the full board meeting, even though it's tabled?
It would be tabled
It-
if this committee come back at the next.
right, so it's tabled till next month's program and budget.
Okay.
Yep.
Can I just ask what division it is? Who, usually staff is here to present it. What division is this?
Finance.
All right, so that item's been tabled till next month. Next item, I'm not even going to ask for a motion right away. I'll let you guys decide because nobody's here to speak on this item either. Item C, request to approve revised MCCMH MCO Policy 9-610, recipient rights, privileged communications. Ryan?
Is this time sensitive?
This is not time sensitive.
Kathy?
Just like the other one, it says the prior approval date was 8/5 of '09. So it looks like there is a policy in effect. This is just an attempt to update it.
Right, if I could.
Nick?
As I think Kathy knows, and as board may have observed, we're in the process of our staff reviewing all of our policies. So they've been coming to us in pieces as they finish them. And I do think, and they're usually, somebody's here to explain it, which seems appropriate to me, or to explain what the changes are, if there are any. There obviously are if they're revising them. If they're significant changes, if they're just technical changes, or what. So, and I don't think it's appropriate for us to take action without knowing what we're doing. So I'd move to table to the next meeting.
Motion from Nick to table, support from Ryan. Sorry, Megan. All right, we have a motion to table item C until next month's program and budget meeting. All in favor signify by saying aye.
Aye.
All opposed? That item is tabled. All right, on to item 5D. I know we have somebody here for this one. Request to approve the AFIA report writing contract. I'll take a motion to approve.
So moved.
Motion from Kathy. Support from Megan. Come on down, Bill.
Hi. Do you have questions on the contract? This is
Did
this
you
is an
want to give
extension
us?
of a contract we had in place last year. When our internal report writer left for another position, he offered to give us some limited number of hours, and we increased the last year's contract by 4 hours a week, and we thought that would be enough to keep up. And we're just asking for a continuation of that contract.
Nick?
The per hour rate remains the same, we're just adding 4 hours, so what's the difference in cost, is what I'm asking.
For the 4 hours?
It would be between last year's contracts and this year's contract. There's just the 4 hours and what,
It's just a 4 hours a week. So last year, we paid, before we added the 4 hours, we paid $7,000 and something a month. And with the 4 hours a week, it went to $8,000 and change a month.
gotcha, thank you.
And we had already had the 4 hours last year
Last
for
year.
a short period of time too as
Yeah,
well.
well, I
So
mean,
this,
we should have got this here in September, but we overlooked it, and so we're bringing it to October.
perfect. Any other questions or comments? All right, seeing none, all in favor signify by saying aye.
Aye.
All opposed? Motion passes. Thanks, Bill, that was easy.
Thank you.
Next is item 5E, approval of residential lease A. I'll take a motion to approve. Motion from Chris. Support from Selena. Any questions on this one? TJ's not jumping up, so. Anybody have any comments or questions on lease A? All right, seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5F, request to approve Residential lease B. Take a motion to approve.
So,
Motion from Megan. Support from Brian. Any questions or comments on B? Kathy?
should have asked in the other one, too. Have all the repairs, have all been done, taken care of? I noticed that they were older reports, so I'm assuming they've been taken care of.
All of the repairs have been done on the, we're on television. That's right. All of the repairs have been done on the A contract. You'll see that they submitted bids to have the flooring replaced. I got word this week, the flooring is going to be replaced in January. So everything else has been completed.
Thank you. Thank you, Mr. Chair.
Any other questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 6, receive and file. Receive and file the MCCMH Marketing and Communications Strategy. Before Cynthia gets started, I'll take a motion to receive and file. Motion from Linda, support from Brian.
I wouldn't support, I just raised my hand. I want to have a, ask a question, I'm sorry.
You're killing me. Is there support from Tony? You want to ask a question now or wait till she's done?
Okay.
We'll wait till you're done.
No, please go ahead.
These American-made shirts?
Pardon me?
These T-shirts are going to be American-made?
These shirts are actually just mock-ups. They're not something that we've ordered at all.
But
Yeah, these are just examples of things that we could do.
Okay, so if
And that-
this get approved, do you plan on ordering an American-made shirt?
Possibly, depends on cost. But unless it's mandatory that I order American-made shirts, but outside of that, I mean, we try to be as cost-effective as possible.
Well, I understand that, but
Yeah.
there's also a cost of who lives in the United States and who manufactured this. We're buying shirts in Taiwan that does not pay in the community, does not pay taxes, does not pay into this county.
Fair point.
I mean,
I understand. Definitely can be something that we work with our vendor, so it would not be a problem. Outside of that, I just wanted to share with you all my marketing and communication strategy going forward for the new fiscal year. Additionally, included in that was our new logo and brand standards. I'm sure you've all taken a look at that, and with your approval, that's what we'll be moving to going forward. Well, with your support, that's what we'll be moving to going forward. I have shared that with several members already. Outside of that, were there any questions in terms of the style guide and strategy? Yes.
Just one quick, you referenced.
Go ahead, Nick.
I thought you called. Just one quick question. The report references a budget, and I don't remember the specific budget on this. Did we, I assume we adopted one somewhere. If we could just get another copy of that at some point, just for our edification. Does the budget that we adopted, whenever we adopted it, include the billboards, the pens, the trinkets, and so forth, and so on?
So we're currently working on the budget for.
Oh, we haven't
yeah.
adopted a budget.
No, we
So my
have,
memories
but
isn't as bad as I thought it was.
maybe. We're working on it. It's not something that's been finalized yet. It'll be based on what we've already done for our budget, that we've done for our overall budget. I understand, to my knowledge, we'll be kind of moving funds around to allocate towards this, and possibly revisiting that. So I don't really have a full answer for you, but I know we're working on it, and we'll revisit it once Dave gets back.
So I guess my question is, did we adopt a line item or something on this issue in the overall budget? And now she's talking about splitting it up, which is appropriate, and will that come back to us, or it doesn't come back to us?
To my knowledge, it wouldn't.
It would not?
Yes.
Is that correct?
I would agree.
We have passed X number of dollars for this sort of issues, and then how it gets split up is done internally.
May I address that, Mr. Chair? Typically, the budget, if as long as it's within the fund, I don't know what they call them, they can move things around without us having to come back to us. But if they want to use additional funds that would affect the the retained earnings, I sound like an accountant, but if it would, then fund balance, then we would have to approve that, so.
Any other questions?
Linda? And,
Oh, what? Oh, sorry. Good job.
Thank you.
Was this, you had come to us that you were contracting with a group. That was only for the website. You did this, or they've weighed in on this too? That company, I forget what the company was.
It's Increased Design.
Okay.
The web development company was Increased Design. The designer that I work with and producing a lot of the materials is 0514 Design. We have a contract with them that we've extended into this fiscal year, that we plan to extend into this fiscal year as well to support the materials that I'm creating internally for the organization. So that's partially with them, not the Increased Design company. This marketing strategy that I did, though, that was all me.
Okay, great. But, so they'll probably, I like it, so they'll probably like it, but I don't know if you have to have them weigh in on it.
Who,
Since you're buying
Increased?
two different things, but they're going to go together because our logo's going to go on the website.
Oh, yeah, no, they work together.
Okay.
Yeah, we're all in collaboration. So Increase, the company Increase is working with 0514 in terms of the brand standards and things like that to make sure that our website is on brand and in alignment with the style guide that I provided. So that's definitely in the works. And actually today I saw some mock-ups for the website, so I'll be happy to share that with you guys as it becomes available. It's really, really cool.
Good, good. And this is a change from something that was first submitted to us. Not sure what changed, but there was something that was off-putting to me, and you changed it, and
Yes.
it's wonderful, so great.
Thank you. Just to recant, for your memory, in that sense, it was the Macomb County community.
Right.
And the bottom was community mental
Great,
health now.
so this
that's
is
what we
great.
changed it.
This is, thank you.
No
Thanks
problem.
for that change. And new fonts, since I've worked, there's a lot of new fonts. This is good. And I love the font where you can write, and you wrote "thank you" at the back. That's at the back, so thank you.
Thank you.
Kathy?
Thank you, Mr. Chair. Thank you for all your work on this. I just love when things get organized and tidy and neat, and then everyone, adopts that, and that becomes part of it. Just a reminder to let, however the agenda gets put in at the Board of Commissioners office, that they get all this too, because they have a different, do we want to use this layout on our
Sure.
agendas as well?
Sure.
Because if you notice,
I actually, I can take a look at that and share that for sure.
yeah, all right. And then there's some goals, which are, good goals for first time doing this. How will we know, how will you know we've accomplished those?
Well, currently, I do believe that I made them SMART goals
They're
to where,
very-
we can kind of check up on those things. These are pretty much my goals for the new year, going into the 2020 fiscal year from 19 to 20. So ultimately, I plan to accomplish all of these goals in the new year. Some of them are more strategy and implementation. Some of them are more line items that we can get done, such as the website. I plan to have the website done by the end of this year. So with knowing that, that's something that I could more so provide a timeline on, if that would make it better. But ultimately, these are just things that I plan to get done in the new year.
Great, thank you. And just for everyone's information, in case somebody thinks of this later, this was also run by the county's person in charge of style for the
Maria's
county as
artist.
well, to make sure it didn't conflict with whatever their guidelines were.
Correct.
right?
I ran it across Maria's artist, who is in the planning department, if I'm not mistaken, before I even tackled this project, because I didn't want to waste my time.
Right.
And so she was very receptive, just told me to share those with her once they were approved. So as long as I have the go-ahead, I will do that. And they didn't have any reservations about us going along and doing this, so
Great, thank you very much for
You're
all your
welcome.
work.
no problem.
Ryan?
Thank you.
This is probably a foolish question, but what is there any symbolic meaning to the arm length, and why the north and the west have a longer arm, and the south and the east have a shorter arm?
I'm just going off of what you guys already had. I didn't want to make too much of a change from what we already had. I didn't want to scare anybody with
That's how it is
switching
in Macomb
it.
County.
Okay.
So that's literally kind of what the old logo looks like. So I just wanted to give it a facelift,
Got
if you
it.
will.
Modernize it, okay.
Yeah.
Linda?
I had the page turned, and I couldn't remember why I had it paged, but now I just remembered.
Yes.
On, it's ours page 66, but on your thing, it's the primary logo and text only. The middle one, why is it justified, not centered?
I don't know why I can't look at this right now.
Because they're centered on other places.
Could you just show it to me, like flash it over to me?
This one that says Macomb County. It's justified
To the left?
to the left.
Variations of how we can use the logo. It's as simple as that. They're
Okay.
all primary, they're all, every logo, every document will not make sense to have this circle. So understanding that, we need to have other options that will also represent us as an organization, and that was one of them.
So it's our page 66, if you guys want. But so that's not a style, that's a style?
That's our
to not-
style.
To justify?
That's our style.
Okay.
That's something that we created, that we said, okay, depending on whatever document, whether it be a brochure, a flyer, whatever it is, this is another option for us to, another option for our logo usage outside of the standard. And I provided more than, I know you see that, so I provided more than 2, more than 3. There are, I think, about 4 to 6 options of how we can use our logo and variations of that, and then also how-tos in terms of what to do and what not to do with that logo as well.
Okay, thanks.
Brian?
No criticism, you did a fine job and everything else, but when I look at a lot of them, they look like a Phillips screw head.
I'm sorry, it looks like what?
A Phillips screw head.
I don't know what that
Screwdriver
is.
that you tighten the screw with,
Okay.
they look like where a Phillips screwdriver.
The logo, do you mean?
Yes,
Okay.
right in the center of it, and
I just went off of what we already had, and I didn't want to make too much of a,
I don't know, that's what it looks like. It looks like, you tighten it for a screw loose.
Yeah. Personally, I thought the old logo looked like the wheel of a boat, if you think of it that way too. So
Well,
that's something
I can understand.
that's something that I wanted to move away from. I think it still encompassed what they were trying to communicate with the initial logo. But if we're not a fan of it, I can certainly go back to the drawing board.
I'm bringing that up because when I was younger, there was certain things that were said about individuals that had issues. Or
Yeah.
challenges, and that kind of meets it.
That meets the challenges.
Yeah, when they say you got a screw loose, and there's a way to tighten it.
Okay.
I'm just bringing up.
No, I appreciate. I definitely appreciate it.
Just concentrate on the arms not being the same length, okay? Just look at that instead.
That's what I first looked at.
Color, it does. It's different when it's black and white too, like if it's the same color. That's how it's.
Thanks.
Tony?
I see the same thing. And the screw loose principle is there. That looks like the top of a flat Phillips bolt, and you're bolting it in. Maybe Brian has a valid point.
It's good, we're tightening up the relationship between the community and CMH. I'm here all night. Any other questions or comments? All right, seeing none, thank you, Cynthia.
Thank you.
We have
problem.
We have a motion and support to receive and file. All in favor signify by saying aye. Aye. All opposed? It has been received and filed. Next up, 7 resolutions. We have no resolutions. Item 8, other possible agenda items. Adam's been super talkative tonight, so I'm going to see if he has anything left to say.
I have no other agenda items.
Nick, go ahead.
Okay, a couple of quick things. The Legislative and Policy Committee met and essentially discussed 3 things. The budget, and as I think everybody knows by now, we were successful in seeing the veto of Section 298 dealing with privatization of the system and changing it to the HMOs. 2, the supplemental appropriation, where we were not successful. There was no supplemental appropriation. Moved on mental health issues, or on at least the one we had wanted. And 3rd, the issue of having a sort of a reception or a breakfast with members of the legislature, which we will be working with the staff on trying to put together. This about a half an hour ago, so I suspect there won't be any detail. People haven't had a chance to review it in detail. I sent out a list of highlights of the DHHS budget as it deals with mental health issues that I plagiarized with permission from my successor at AFSCME. He had done it more in a, here's what we think is a good and here's what we think are bad. I took all that out and just listed the major issues. You can decide for yourself which of these things you think were good or bad, although I think most of them we would agree on. However, there's like 5 pages of those issues that are still somewhat up in the air because there will probably be some movement in the legislature, either on the legislature resubmitting provisions that will probably just be met with another veto, or of some further negotiation process between the legislature and the administration, which I think will happen. I don't know if it'll happen sooner or later, we'll see. And it would make sense, I think, for us to pick a smaller number than 5 pages of these to be of, because some of them really don't apply directly to us. They apply to other people in the community mental health system, but some do affect us more than others. So to that end, I would like to call another meeting of the Legislative and Policy Committee meeting. This time we don't have to do it with Barb suggested tomorrow, but I said, no, that was probably not a good idea. That's what we did the last time, was Friday. But within the next few weeks, maybe not next week, but the following would probably be good. And so if people can look at their calendars, I asked Barb if she wanted to do it by survey, and she insisted that we do it here, so and being someone who always listens to Barbara, and whatever she tells me to do, if people could look at their agendas for the week of October 21. Oh, that's the conference, I'm sorry. That's the conference, so that won't work. So the week after that? Any day but Monday should be okay for me. Yeah, it's another, over my better instincts, it's another 7:30 a.m. meeting, and the 31st is Halloween, so that's, well, any day that week is good, is there, except for Monday. So Tuesday the 29th, is that a
That's
problem
good.
for anybody? If it is, we got the whole week to deal with.
I can only do Friday that week if Monday is out, because we're in session the
Oh, that's
29th,
right, you're
the
back in
30th,
Friday.
and
So
the
you want to do it
31st.
Friday, November the 1st?
That work?
Does that work for everybody?
Yes.
All right, going once, going twice. Barb, I'll get you a proposed agenda, and you'll put the notice out at the appropriate time for November, for All Saints Day, November 1st, okay. That's all I have.
Thanks, Nick. Linda?
I haven't been hearing this in any conversations about the mental health budget, or the, some people are very upset about the veto items that are places that people we serve go to. But I passed around to a number of people a newspaper article with Robert Gordon, the director of DHHS, who said the original, and I'm just saying this because nobody else is telling this, except me or Robert Gordon and the Macomb Daily, that the original budget had cuts to mental health, substance abuse treatment programs, children with disabilities, and autism, and something else. So the original budget that everyone is, that a lot of people are hanging their head on, had cuts to us too. That is a problem for me. That's a problem, that it had cuts. And Robert Gordon will be the keynote speaker at the conference, so we hope to hear more about that there. I just wanted to even the field on what's happening. Thank you.
Nick?
Just to speak to that in terms of process, because it gets muddled in the press. Now, the original budget, I don't know which one he was talking about. I assume he's talking about the legislative budget. The original budget usually refers to the ones the governor sends over to the legislature. Yeah, so that was the budget as passed, I think he was referring to. 298, well, the process was going to be, usually what happens is that there's agreement between the executive branch and the legislative branch on most of the major issues of the budget before it's adopted. There are some things that still get vetoed here and there. This year, the budget negotiations broke down completely between the two branches. And I won't get into the battle, but the legislature says it's the governor's fault, the governor says it's the legislature's fault, and that's probably comes as a shock to no one. But at any rate, the process did break down. The legislature the governor had indicated that if the legislature sent her a budget without her input, that she would extensively veto it. At some point was talking about vetoing it completely, which would have shut down government. She chose instead to veto a substantial, I'm sorry? Right, but that's a different issue. But a substantial amount of the budget was vetoed. Some of those vetoes you and I would probably agree on, some we would disagree on. One that we agree on is 298. That was a priority for this board. I'm just suggesting that procedurally what I suspect will happen now is at some point or another, because we're talking about $1 billion worth of vetoes. So we're probably talking about a substantial amount of negotiations and give and take on where to put that money. As you'll see in my email, a lot of that is outlined there in terms of how it affects the community mental health budget. There's a lot that doesn't. There are obviously 18 other budgets. So that's the reason I wanted to call the meeting, was to try to do that. On 298, though, the point I did want to make was in a Cranes article, I believe, Director Gordon was quoted as saying 298 is the way of the future, expecting it to come back, not necessarily in the form the legislature passed it. The governor was quoted as saying that integration of physical and mental health care is important, which I think we all agree on, but that we needed to try to bring more people to the table to discuss how to do that. Those are conflicting statements within the administration. So when there's conflicting statements within the administration, it's a good opportunity to try to sway the administration our way. Fortunately, we got the appointer rather than the appointee agreeing with us, and so I think we have some shot of doing that. What will happen with the legislature is yet to be determined, obviously. None of us have a crystal ball, but I think that I want everybody to be aware that 298, though vetoed, is probably coming back in some form, and we still have a lot of work to do.
Anybody else? All right, seeing none, we'll close other possible agenda items, move on to hearing of the public. Anybody from the public? Going once, going twice? We will close the hearing of the public. I'll take a motion to adjourn. Motion from Megan, support from Nick. All in favor? Aye. We are adjourned. Have a good night, everyone.